You would be surprised at how many people are out there that are being affected by their living space and they don't even know it. Am I serving the insurance company? Am I serving sort of the medical community? But am I really serving the patient?
All right, Dr. Heyman, we're here, Daru Strong Performance Podcast. Thank you so much for joining me and getting into this, I would say what you would call interrogation room, right?
It kind of feels like that.
Feels like that, right? Well, we're going to go over a series of questions. We've got 20 minutes, right? We may be able to do 2 episodes, but the first question is going to be on your holistic approach to chronic illness. Now, the first question that I have, though, is going to be, in your experience, how has holistic approach to medicine altered the treatment outcomes for patients in chronic illnesses compared to conventional methods?
That's actually a really good question. And I think when I look back over the work that I did at University of Michigan when I was a regular family physician, and you're checking all the boxes and handing out prescriptions and, quote, doing the right thing, mm-hmm. If you're really honest with yourself as a practitioner, you realize nobody's getting better. Mm-hmm. Nobody feels better. Nobody does better. Nobody performs better. They don't have any more vitality. Mm-hmm. And you think, what am I doing? You know, am I serving the insurance company? Am I serving sort of the medical community? But am I really serving the patient? Mm-hmm. Are they getting better? And that's when I really started to kind of transform my head and said, how do I ask a different set of questions? How do I look at patients differently? How do I actually answer the question, what is health? And how do you build health? And that's a different enterprise completely than dealing with chronic disease. When you break out of that box, you realize it's almost like learning a different language and seeing information differently, putting pieces of data together differently, getting new insights, which leads to new treatment options. Okay. And so there's a whole new world that you're exposed to as a practitioner, and that's where the magic happens. But to make that transition out of the box and to say, I'm going to serve that individual's needs, not the medical community, not the insurance company, that's when we see lives transform. Mm-hmm. It's not an easy thing to do, to try and retrain your brain to think differently and ask a different set of questions. But it's made all the difference in the world for me and for my patients.
How are you integrating the two from a traditional standpoint to now the new modern technology?
Mm-hmm. The way I think about it is we have these 2 different models. We can look at a patient through a more kind of traditional healing lens, mm-hmm. where we see the person as a whole person in a whole environment, as if they're sort of this ecosystem. And we want to nourish them, we want to care for them, we want to give them things that help the person grow and thrive and be robust physically, mentally, emotionally, spiritually. These are very old ideas. It goes back to, in fact, my original training in traditional Chinese medicine. I was 17 years old, and most of my instructors were Tibetan and Zen Buddhist monks. And they said, we can teach you technique. We can teach you techniques that are 3,000 years old that we know work. Mm-hmm. But there are 2 things you need to know. Number 1, who you are as a practitioner and what you bring to the table has a lot to do with your patient's outcomes as well. Are you mindful? Do you listen? Are you careful in your approach? And do you serve the patient without ego? That's the first. And the second is, even if you get all that right, never forget, as a gardener, nature is what makes the garden grow. Mm-hmm. It's not you. You can prune and weed and help the soil and give nutrition and all of that, but at the end of the day, there's another process that's going on. So all these older traditional healing methods were called vitalist traditions. Traditional Chinese medicine, Ayurveda from India, homeopathy from Western Europe, naturopathic medicine, herbal botanical medicine, all were tied together through this notion of vitalism. And then came along conventional medicine many years later, and we began to see breakthroughs in objective measurement of different aspects of physiology. So blood circulation was identified in the 1600s. We could objectively measure body temperature. And eventually that led to new insights with public health measures and cleanliness and vaccinations and immunizations. And the power of that approach, this sort of reductive model, became premier and preeminent. But what happened was we also ended up rejecting those vitalist notions. Okay. We lost them along the way. And my job now is to be good at both. Can I be the vitalist? Can I help my patients thrive and heal? Mm-hmm. But can I be the technician, the ultimate technician? Can I still be a great doctor and know the science and apply that in sort of its highest order? How do I hold both of those worlds in my head? Mm-hmm. And that's the challenge, I think, of what today's kind of new medicine is, the kind of 2.0, where you need to be able to do both simultaneously.
It's funny that you mentioned that, because the way that I organize training plans are based off of subjective and objective indicators. Mm-hmm. And looking at it from a holistic perspective, we want to see if the athlete is coming in and feeling good or not. And so we have to have that understanding of the body. Right? You have to know your body. You know, a lot of people say that. And from there, we utilize objective indicators based upon how they're feeling. And then we can alter or auto-regulate if necessary. Mm-hmm. Tell me the role that nutrition plays in all of this, and how, we'll get into biotoxins in a minute, but nutrition as a whole, from a holistic standpoint, how that can be integrated into whether it be the new medicine, right, from a modern standpoint, and also how it's going to allow for that person to feel their best.
Yeah. So every patient of mine, we take a deep dive into the role of nutrition, both generally and specifically for that individual. And, you know, I take the tactic that, you know, one diet doesn't fit all, but everybody has to have a relationship with food and use that as sort of a building block for health. So how we move, how we breathe, how we rest and recover, and also how we fuel. And you know, people have a relationship with food, and sometimes it's not a very healthy or positive one, you know. And sort of, as you say, you can take a technical view and just look at macros and micronutrients and be really good at all that. But even that happens in a context. I'm sure you've got fighters that struggle with their diet and sort of how they relate to food, and they might have cravings or other issues, and you're sort of fighting some of that to get them, you know, fueled properly and to kind of optimize their metabolism. Patients are no different, and yet it is one of the foundational building blocks. One of the challenges in this country is the food supply is terrible. We've stripped the nutrients out of the soil. A lot of it is packaged. There's a fair amount of chemicals and other adulterants in our food supply. And so it's hard for people to kind of get access to, you know, dense nutrients. You have to work harder, and you got to spend a lot of money to get there, unfortunately. But there's no way around it. I mean, so much of chronic illness is derived by poor dietary habits. But to change how that happens in real time with a patient who's struggling and they've got a busy life and kids and work and stress and all the rest, it's not an easy thing to do, but we have to do it. So I always measure sort of aspects of nutrition and food in my patients. I also look at gut health in particular, so the relationship between nutrition and gut health. Is the gut functioning normally? Because you can have a great diet, but if your gut isn't working well, you're not going to absorb those nutrients or process them effectively. So we always look at that kind of nutrition-gut interface in particular.
What are the signs that you see that somebody has a significant amount of gut issues, let's say from a gut dysbiosis or any type of, like, maybe it's brain fog? What are some of those signs that you see?
It's just, you could spend a day in my clinic and it's every single patient, pretty much. And it's because stress affects the gut, medications affects the gut, heavy metals and chemicals affect the gut, poor nutrient affects the gut, and that's when you start to see the dysbiosis and the leaky gut syndrome and inflammation along the gut lining and poor, food breakdown. So the classic symptoms tend to be bloating is a big one people talk about. alternating constipation and diarrhea, abdominal pain, reflux. All of that is sort of just along the gut. But then extra gut, the typical ones are going to be fatigue, aches and pains, water retention, but also mood swings. So patients will feel anxious or depressed, and brain fog. Brain fog is an interesting one because there's no great kind of objective correlate to that. There's like no measure that I can do to say, here's a marker for your brain fog. But I have a lot of patients when I say, you know what, if you've got it, do you have brain fog? And they go, oh yeah, I feel like I'm pushing a thought through Jell-O. Yeah. My head is in soup. And it's actually a strong indicator, for food-related issues,
And this is dose dependent, it's subjective, right? So one person can have, let's say, sweet potatoes, and it could be good for them, and another person that may give them that brain fog, right?
I'm often surprised because you can have healthy foods like sweet potatoes, and some person's immune system has decided that's no good. I'm going to react. I'm going to get inflamed. The hard part sometimes is that you have what are called delayed reactions. So I eat my sweet potato today, but I don't have my brain fog until tomorrow. I mean, I can't remember what I had for breakfast this morning, let alone what I ate yesterday, right? So sometimes it's hard for people to connect the dots, which is why, food testing panels can be helpful. I think the science has improved in the last few years. We're getting better at identifying what are true food reactions versus more positive immune responses. But so I check food panels in every single one of my patients. I want to know what they need to eat.
Sure.
Right.
What are some of the gut testing that you do?
So there's a few that are out there. And I think the food testing has leaped ahead of the technology of gut testing. So you have companies like Genova that does GI effects. You have GI Map. You've got Viome. They're all pretty good. The problem, though, is that measuring what's going on in the gut is about as effective as looking into the Mariana Trench. Like, it's just very difficult to do. And so because it's typically stool testing, we think that under the best of circumstances, you're measuring maybe the lower third of the colon in most of those food panels. Okay. There are new companies using AI to try and better map what's going on throughout the gut. But that new wave of sort of assessing the function of the GI tract, I think we're only in the coming attractions. We're a little further ahead for testing for food.
Okay. Switching it up a little bit, because we've talked about this extensively with a patient of yours and an athlete of mine. Let's talk about biotoxins.
Okay.
Let's talk about the relationship of what they may be going through and what they're seeing from a performance standpoint on top of how well they're able to cope in everyday life. So not just about how well they're doing in the gym, but also just living.
Yeah.
What roles does that have?
So biotoxins, this is a huge topic, but a biotoxin, let's give a definition first, is essentially an organism or fragment of an organism that a human comes into contact with that inflames the body and it inflames the brain. This is an area of medicine that essentially has been completely ignored. The textbook of medicine, the chapter in the textbook of medicine is blank when it comes to this, essentially. It's not something that I was even attuned to or familiar with until 2014, 2015, when I had patients with unexplained symptoms that would not get better with anything that I did. And my toolkit is kind of like yours as a trainer. Like, I have a big toolkit. And patients will come with the brain fog and fatigue and weight gain and sort of these vague symptoms that were sort of ruining their lives. And I didn't know what was going on. And I was pretty good at regular medicine. I was pretty good at functional medicine and anti-aging. I would do all this testing and nothing would come back. And yet it was patient after patient. And eventually we sort of figured out that it was a part of the immune system that we don't normally measure that was being triggered. Triggered from what? The most common biotoxin by far is what we call amplified microbial growth, basically mold and other types of microbes in our homes. And this notion of kind of healthy people in healthy environments, we tend to focus on the person. We pay very little attention to the quality of our living space. And what I found is that as the deeper I went into the science of it, it was this whole other world that I had ignored and many other practitioners ignored. I think it's actually one of the greatest failures of primary care and public health. And this recognition that if you're living or training in mold, it can generate an immune response that wrecks the brain and it wrecks the body. And one of the things that is sort of a hallmark of the illness is reduced athletic performance. We see a decline specifically in VO2 max. We see a lowering of the anaerobic threshold where even lighter efforts become laborious. People spill right over into that lactic threshold and they say something is wrong, I'm not performing the way that I should, and they can't figure it out. They change their diet and they try and recover better and they try nutrients and stem cells and exosomes and peptides and all the things that are out there, and they say, I still feel like crap.
Yeah.
And it turns out it's what you're breathing in that's inflaming the system to the point where everything becomes compromised.
So with that, what are some of the other biotoxins that you see, and what are the similarities that you see from those biotoxins that could alter somebody's judgment on what they have?
So there's a list of biotoxins. As I said, the most common by far is our living space. 80% of the time it's going to be that. 20% of the time it's a grab bag of other organisms. And in that grab bag you can find things like Lyme, COVID. In fact, I'm a strong believer that long COVID is essentially the same thing. When you look at our genomics research and our sort of inflammatory research, we see the same metabolic pattern for people who got COVID and then they remain sick and they don't know why. Algae blooms, red tide here in Florida, Pfisteria that blooms in the Chesapeake Bay. So bodies of water that where their pH becomes altered and we get this overgrowth of abnormal organisms, that too can cause the same sort of abnormal immune response. So there's a bunch of things that are out there that can also do it, but by far it's mold and its friends that are growing in our home.
As far as the strategies to managing them, there were some things that you had this individual that we worked with do.
Yeah.
Let's go through the list real quick. When they find out that they have biotoxins or mold infestation or these issues that they're having, what are some of the ways to combat that, and how can you go about getting them back to full go?
Yeah. So let me start with the strategy, and then I'll go into some of the tactics. And then there's one sort of special topic that is near and dear to, I think, both of our hearts. The strategy in general is you got to turn off that inflammation. You got to correct that underlying metabolic disruption that also happens. So we see weight gain, we see elevated blood sugar, we see thyroid abnormalities, we see loss of androgen drive, so low testosterone and the rest. But the thing that is, I think, most insidious about this and connects directly into, I think, your community in particular, we have a body of research to show that one of the consequences of that inflammation that not only creates a metabolic disruption and all the symptoms and misery is that if you leave that inflammation to go long enough, it will damage the brain. And I now have a current research study to show that the injury to the brain looks almost identical to the pattern that we would typically see for traumatic brain injury. So I work with a number of brain experts, neurologists, neuropsychiatrists, behavioral neurologists. We've done very specialized brain scans to show that it's pretty predictable. So there's a reason for the brain fog, there's a reason for the cognitive decline, there's a reason for the mood instability, there's a reason why people make bad decisions when they have a brain on fire, because that fire is burning down structures in the brain. And so by virtue of that, yes, you can turn off the inflammation, yes, you can deal with the metabolic disruption, but you're also left with organs and tissues that are literally damaged from this chronic inflammatory process. Those are the treatment buckets. Within the buckets, then, how do we turn off the inflammation? The mainstay for us is a category of medications or natural compounds that act like glue or a sponge, and they soak up these lipid-soluble inflammatory compounds. They're called bile acid sequestrants. So the medications that I use are ones like Welchol or cholestyramine, but I also did some primary research to show that natural compounds like okra and beets are actually also really good at soaking up this inflammation. Unfortunately, we don't have a lot of choices in that particular category. But when I get a patient going and I say, yep, you're being exposed, that's the first grouping that I reach for. The other thing that I do is we try and turn off the fire in the brain right away. And so there's a product called synapsin. And synapsin is a combination of two natural compounds, an extract of Chinese ginseng called RG3, and the other is nicotinamide riboside, which is a vitamin B3 derivative. And we have found that they're both incredibly neuroprotective. They turn off the fire in the brain and they encourage repair. This is a complete breakthrough. And what I think of it, it's almost like, natural medicine 2.0, where these are natural compounds that have drug-like effects. And so it's a whole new world in terms of the kind of toolkit that I have available to me to really correct these underlying issues. So I reach for synapsin, I reach for okra beets or a Welchol, and we get the patient going. The other critical thing, of course, is we have to reduce the exposure. So we have special cleaning protocols for them. We have them get special air filters. My favorite is one from a company called Air Oasis. It's called an iAdapt Air. So it has different kinds of technology that don't just clean the air, but they actually chew up the microbes that are floating around. So you have a photocatalytic, UV light, ozone, charcoal, HEPA. So there's that piece. Once we reduce the inflammation, we then move on to the metabolic disruption. This is your world to some degree, because I know you're really into this stuff. And so what we see as a consequence of all that inflammation is, as I mentioned, blood sugar goes up, thyroid levels are in the tank, the gut is a wreck, nutrition is a problem, hormones are not in balance. They also, because they're more acidic, they tend to accumulate toxins like chemicals and heavy metals. So what I have to do is work really hard in that middle space to balance their nutrition, balance their hormones, detoxify them, kind of get that cell metabolism and cellular flexibility and efficiency working again. Even then, what am I left with? I'm still left with damaged tissues and organs. So even if I've turned off the inflammation, even if I've improved metabolic efficiency, I'm still left with a damaged brain. And so the way we correct that is with peptides. There's one in particular that I like to use. It's called vasoactive intestinal peptide. It's a natural compound that our bodies normally produce. We have two different types of VIP receptors. But when you take it either as a chewable or a nasal spray, it dilates blood vessels, VO2 max goes up, we oxygenate the brain, we get the genes and the mitochondria functioning normally again. And when we've done pre and post studies, we've shown that when you go through all that, the brain heals. So we can get people all the way back to normal, but it's a process. There's maybe, and this is not an ego statement, there's probably 5 physicians in the world that really know how to do this well.
Sure.
I've trained 300 or 400, but this is the deep end of the pool. You have to know a lot about regular medicine because these people are really sick. You have to know a lot about functional medicine. You got to know a lot about regenerative medicine to get this right. But there is an approach and a protocol that we've sort of worked out over time, and this is where my active research agenda is too. So I can take someone who's been pretty sick from mold and get them doing better and feeling better and performing. You would be surprised at how many people are out there that are being affected by their living space and they don't even know it.
With that being said, part 1 is done. Stay tuned for part 2, because we're gonna go dive a little bit deeper into how you can find out about all these issues that you're having, if you are having them, and how we can combat that. All right, we're back, part 2. Dr. Heyman, thanks again for joining me. We went deep. We started going real deep down the rabbit hole. So I want to finish our talk on biotoxins. I know this is something that is near and dear to your heart. When it comes down to collaborating with other healthcare professionals, you're kind of like the head coach when you have a particular individual that is diagnosed with this issue. What are some of those individuals that you're collaborating with to help get everything organized?
So I do have to build a whole team around the patient. Naturopaths, which I think are very good at sort of doing the nutrition piece, general dietary supplements, lifestyle-related issues, and detox. Beyond that, I often have patients work with a psychologist usually one that is skilled in trauma. And the reason for that is because more and more I think about it, when you're exposed to a biotoxin, the first system that really becomes inflamed is the nervous system. It's the brain, it's the autonomic nervous system, the peripheral nervous system. And so there's sort of a biological trauma that occurs. And we begin to see alterations in autonomic response, decreased heart rate variability, poor heart rate recovery. And while that's, physiologic on a certain level, when the person begins to realize that it's the home that's making them sick, their sanctuary, their what's supposed to be their safe space, and then they start saying, I don't want to go home because it's making me sick. But that's where their family is. That's where they're supposed to be relaxed. And then they say, well, where am I supposed to go? So there's a trauma that begins to build in terms of where should I be? Where can I go to heal? No place is safe. And when you have an inflamed brain and your mood is all over the place, you realize your body's not safe either. So trauma-based work on every level is key. So I have to get these patients connected in. If they don't have a local practitioner, especially can do something like EMDR, the rapid eye movement technique to reset trauma. I'll have them do some online programs like the Annie Hopper DNRS, which takes them through a series of mindfulness and breath work. In addition to that, they need either a trainer who's really attuned to their physical limits and capacities, or an exercise physiologist. They're so compromised in their cardiopulmonary status that it takes someone who understands what that upper limit is and can slowly creep them into a greater fitness state. They tend to be quite sedentary because they're tired, they have brain fog, typically aches and pains, but they have to start moving. But how you get them to move is critical. I generally have them begin on walking programs. That's almost the only thing many of them can do. But again, I even see it in elite athletes. I've had a lot of patients who you can turn on the TV on Sunday and you can see them performing. And I get a call saying, I'm not as sharp as I used to be. I'm not throwing the ball the way I should. I'm not jumping the way I should, or my times are off. I don't know what's going on. And they sort of begin to think, well, maybe it's an exposure. So I need people who are really sharp in the training area to understand what that limit is and how to begin to slowly push that limit.
Let's talk about that from a training perspective, right? So would you start them off, even at a high performance athlete, you would bring them down to a walking type of intensity, zone 1, right? Keeping the heart rate low, obviously working through the talk test, making sure that they can hold a conversation.
Yeah.
Weight training wise, what's that look like too as well?
Weight training is not so bad because this is more of a cardiopulmonary restriction. It's, as I had mentioned, loss of VO2 max in particular. So people are winded just walking up a flight of stairs. And I've seen that even in trained athletes. I mean, hell, it happened to me. I mean, I was a trained triathlete. I got bit by a tick. I got Lyme. And my fitness just went in the tank, and I had no idea why. I was training for an Ironman, was on a 6-mile recovery run, couldn't run a mile. I'm like, what the hell?
What was going on? Was it more of it was cardiorespiratory, obviously?
Yes.
So did you feel completely out of breath, or did you feel
totally
everything was done?
I was really fatigued, like a deep fatigue, but I was out of breath.
Yeah.
And I couldn't even run a mile. I remember being bit by the tick and not thinking anything of it, because of course in medical school, they don't tell you anything about Lyme disease.
Yeah.
Years later, I sort of figured it out, took a bunch of antibiotics thinking that would correct the issue, not realizing that Lyme creates this chronic inflammation the same way mold does, the same way those other biotoxins do. So if you don't know how to turn off that inflammation, you're screwed.
What was some of the things that you did to help combat that?
So I took Wellcall. I also took a fair amount of other natural anti-inflammatories beyond like the synapsin. So some of the stronger ones are curcumin, boswellia. There's a really interesting product called SPMs, or specialized pro-resolving mediators. SPMs basically are derivatives of fish oil. And what they do is they bind to macrophages and they transition an activated macrophage, which is essentially the thug of the immune system, and they turn off the macrophage. So it transitions into a more benign sort of state. So I took a lot of SPMs, but then of course I realized that I had to start cleaning up my environment. In fact, I was so sick, Phil, I actually lived in a tent for 6 months.
Really?
I lived in a tent. That's how bad it was.
Was it in the back of your house?
Yeah.
Yeah. Well, at least it was in the back of your house.
Yeah. I mean, it was, and I learned to compensate because everybody's different in terms of how they react, but a big one is memory for people. They start to feel almost like they're getting Alzheimer's.
Yeah.
And that was true for me too. So I remember I would sit down with a new patient for an hour and a half, and I'd pull them back 4 weeks later after we did their labs, and I couldn't remember meeting them. So I learned to just write copious notes and make sure that, so that was a big one for us. So I really worked on my memory, my inflammation. It's been a journey, and my journey is exactly the same as all these other people who've been sick from the same thing.
I was going to talk to you about that, success stories and the challenges that you had through those success stories. Give me some of those and like the practices through functional medicine and all those other means of getting them better. Yeah. What were some of those ways that did it? And then also those challenges that you had to meet along the way.
So for me, these are precious things that have happened in my life, sort of these stories of healing and hope. Because generally speaking, especially for the kinds of patients that I see in my practice, they've seen 10 specialists. They've seen all the functional providers. They've taken all the supplements that you can. They've done every diet you can think of. They've done the ovo, vigo, lacto. I'm going to do intermittent fasting on every other Thursday, blah, and they're still sick.
Yeah.
And so to take someone like that who is not only really debilitated, but they've gathered a lot of labels from the medical community: chronic fatigue, fibromyalgia, atypical depression, chronic migraines, resistant weight gain. You sort of see the grouping. One of the other common labels that I see in my patients, and this is a story that's pretty extraordinary, but actually kind of common, are neurologic diagnoses. So for example, I have a patient, she was diagnosed with early onset MS. And when I started working with her, she was wheelchair bound. She's seen a number of neurologists, and they said, get your affairs in order. She was 56 years old. She was declining quickly. She had gone from a healthy woman to someone who was incredibly physically incapacitated. And they said, this is a rapidly progressing type of MS. We've scanned your brain. We've done all the blood work. And there's really nothing we can do for you. Married, kids, the whole thing. And through the grapevine, she heard about my practice, and we, did the testing that we do. We looked at her genomics. We looked at patterns of gene expression. We scanned her brain. We did a set of specialty labs. And sure enough, mold was her problem. And it was basically causing inflammation throughout her brain and nervous system, which began to appear like MS. It was destroying her nerve tissue. So we went into rapid action. I called in experts to help her remediate her home. We got her on the special binders to strip out inflammation. I gave her synapsin. We did some other natural compounds, like the ones that I've mentioned. The other one that I like a lot are phospholipids. So phospholipids are big components of cell membranes. So the outer cell membrane and also inner cell membranes around the mitochondria, the endoplasmic reticulum, these become altered and damaged in chronic inflammation, and it's a part of why cells are so diseased. So I do a lot of phospholipid therapy in my patients as well along the way. Here we are 2 years later, and she just sent me a video of her skiing in Aspen.
That's awesome.
And her family can't believe it. No one can believe it, And the neurologist is saying, well, maybe the original diagnosis was wrong. It was just all in her head. It was just stress.
Of course.
Right? It was her fault.
Of course.
That they made the wrong diagnosis.
Do you see that a lot?
All the time.
Yeah.
All the time.
A huge amount of psychiatric issues come from medical doctors telling them that they're crazy.
All the time.
Because they forgot how to actually diagnose the patient the right way.
That's right. And so what we see in categories like this and other related categories, it took my research group a long time to find and measure the inflammation that was being generated from these exposures. And these are labs and a diagnostic approach you don't normally see. But when we found it, we knew we had it. The problem is medicine at large doesn't understand how to do this. They don't know how to look at these labs. They don't normally, order these labs. They don't know how to look at these tests. I've done a lot of work. I've written a whole textbook on the subject. I've published, I lecture. I try and do it right in terms of saying, okay, I'm out of the box, but I understand how to operate inside the box too. I'm a faculty member at George Washington University. I'm active in publications and research. I speak that language, and still, there's resistance, still. I'm sure you see it maybe in your own work too. I mean,
Always.
There's sort of a dominant way of thinking about how do I train an individual, right? And it might all be great. And then, you have a way of doing your thing. You say, you know what? The new science says this, but it takes a while to pull the herd along to make the transition.
Well, there's also experience that you've gained over the years and seeing this over and over and over again, that you have a system in place. And a lot of times people get stuck in a dogmatic approach and they don't look at the evidence that's right in front of them. So that's the biggest issue, is being stuck in we call it an old school mindset.
Yeah.
And the biggest contributors to health and science are the ones that are able to combat that and want to find out more and be more curious, as opposed to that's how we have always done it, and you can never grow from that.
I think, unfortunately, medicine in general kills curiosity. That there's a forcing through the insurance company and how we're trained and what the professional expectations are to follow protocols, to be in a box, to not think creatively, not be artistic, not connect dots, and stop asking the question, how can I help my patient be healthy? And all you do is you end up asking the question, how do I manage their disease? Those are two very different paths, and they end up being two very different outcomes. I don't see very much stories of hope and healing in chronic disease management. But when you leave the box and you get creative and you become a dot connector and you keep asking questions and you stay humble, that's when we see the magic happen.
Real quick before we head out, I want to go over chronic inflammatory response syndrome, CIRS. You have a full lecture on it. I went through it a couple of times because I had to. It's long, so you guys can check it out on YouTube. But explain a little bit about CIRS and what it is.
So chronic inflammatory response syndrome, or CIRS as an acronym, is basically describing a bit of what we were talking about. So it's a category or a descriptive term to say it's a person who's encountered a biotoxin that has established this ongoing inflammation. But the insidious thing about the illness is that there's a group of people, and it's up to, we think, 20% of the population, that once this inflammation starts, and if you're in that 20% for genetic reasons, the body has a hard time turning off that inflammation, even if you treat the Lyme, even if you move out of the mold, even if COVID came and went, even if you stop swimming in the algae or you get away from the red tide, that people are left with this devastating illness that won't go away on its own. We used to think that inflammation would just peter out over time, but in this particular category, it's chronic by nature. So we have to develop strategies to turn it off. And if you don't turn it off, that's when it begins to damage organs and tissues, and especially the brain.
When and where should they start to identify this issue, and how can they get tested for it?
So I think maybe the simplest thing that a person can do is, if you have a grouping of symptoms where you have fatigue, mood-related issues, maybe some extra anxiety or depression, if your memory isn't so good, if you have a variety of aches and pains and maybe digestive complaints, weight gain is a big one. And I've seen patients gain 40, 50, 60 pounds.
Oh, huge weight gains.
Big weight gain.
Damn.
And they try and change their diet. It's the normal response. They change their diet, they exercise, and they can't lose the weight. Even if you're on a good exercise regimen, this patient group we've shown in our data, they'll lose maybe a half pound a month. And there's complex reasons for that, but at the end of the day, there are areas of the brain that have become damaged, essentially leptin receptors. So they develop a leptin resistance.
Okay.
So the posterior hypothalamus becomes injured by the inflammation, leptin levels go up, they can't regulate their appetite, metabolism becomes sluggish, and they gain a ton of weight.
Wow.
And then you pair that with the low VO2 max and sort of the fatigue and the brain fog.
You can't even train.
You can't train.
Yeah.
So if you're kind of in that category and you're thinking, gosh, this starts to sound like me. I'm tired all the time and I'm grumpy and I've gained a bunch of weight. And you go to your local doctor, they say, oh, you're depressed, here's your Prozac, right? I mean, that's typical. What patients can do, or if you're thinking about this, I suggest going to a website called survivingmold.com. And there's a visual test there called the Visual Contrast Study. It's a direct measure of inflammation in the brain. It was originally developed in the military for fighter pilots. And it's a color-based study, so you need your vision to be at least 20/50 or better. You can wear glasses or contacts, but you have to have 20/50 or better vision to take the test. You'll see circles on the computer screen that are presented to you, 45 of them for the left eye, 45 for the right. There's lines in the circle, and you have to say which way you think the lines are pointing. The circles are gray, and the grayscale changes from circle to circle. So it's basically testing color contrast. If you have a hard time seeing the lines, it typically means your brain is inflamed. And it's almost always from a biotoxin. If you fail the visual test and you have all the typical symptoms, you have about a 98% chance of being in this category.
Wow.
So just by doing the visual test and having a bunch of symptoms, it's a good indicator of, you're potentially in this category.
And it's quick and easy to do.
It's 10 minutes.
Yeah. I've done it. I remember.
Yeah.
I was like, oh, I better not mess this up.
Yeah.
Yeah, no, it was, because we've had our conversations. Obviously, we're going to be talking about my results, and we're going to be working together too. So you guys will catch later on how we've integrated some of these measures and also figured out what's going on with myself, because I push the envelope a little bit too much a lot of times.
And I have to say, I always worry about high performers that are in the space where there's a risk for concussions and TBIs.
Yep.
Because if you're training or living in mold and it's affecting your brain, and then you're in a combat sport, for example, or you're in the military, or you're a first responder, or you're a professional athlete, and you're shaking the jello, it's even worse. So this is where our worlds really, I think, intersect quite a bit.
For sure.
And we want to work really hard to protect people's brains, turn off that inflammation, get them performing and living and operating in clean environments, because what's more precious than your brain?
Absolutely. When it comes down to where you're seeing this research, are you gathering evidence based on your own? Obviously, you're gathering evidence on your own, but is there anything that you're looking at from a functional medicine standpoint, and how does that alter or help with your practice overall?
So I have a number of sort of fully credentialed research studies that are occurring right now.
Yep.
So they're IRB approved. And there's one in particular that I think has caught the attention of the public. And in fact, I was asked to go to Capitol Hill, and I met with a bunch of Senate staffers and senators because the research study is specifically measuring that overlap and intersection between what happens to the brain in mold and what happens to the brain with traumatic brain injury. And in particular, the question then is, who are the special populations that might be more at risk for this? And the first group that comes to mind, of course, is the military.
Yep.
So this gets into military readiness, it gets into fitness, it gets into performance, but it also gets into veteran suicide. Because you think about the three major forces across the brain, PTSD, environmental exposures, and TBI, we are beginning to believe that's a much better model for how to assess and deal with individuals that have gone through the military, they're now a veteran, and they're not doing well, and they're actually thinking of suicide. The standard rate, the stated rate is 22 vets a day. We know based on more recent research, it's probably more like 45. And when you talk to guys that have been through the military or people who have been in combat sports and they know that they've been living or training in moldy environments, and then of course by virtue of the activity, you put your brain at risk just because of the concussive events, people really feel it and they know it.
Yeah.
The problem is medicine doesn't have a model for this. Most of the time it's, well, I guess it's happened. There's no drug for this. No neurologist is going to be like, oh, here's some treatment for you. There are no answers there. So that's why we have to dig into functional medicine. We got to dig into regenerative medicine. We got to look at stem cells and exosomes and peptides and high extract botanicals like synapsin and other things to try and rein in this inflammation and repair the damage. I will tell you, your local, friendly physician is not thinking about this stuff, and yet it's really common.
All right, so last question. Talk about metabolic code and its integration to Metabolic Elite and the supplements that you use?
So Metabolic Code is a company that I'm involved with. I'm the chief medical officer, and it's a digital health platform where we wanted to leverage technology to assist in the process of more precise diagnosis of individuals and the automation of personalized plan development. So we're using very sophisticated technology and data analytics to do a deep dive on the individual. So we get blood, we get urine, we get saliva, you answer a bunch of questions about your health, we can link into biometrics, we collect a ton of data on you. And then with the assistance of mathematical models and tools, we can then more precisely identify where your areas of metabolic robustness, but also where are you beginning to degrade? What areas of your health and metabolism are starting to stress and strain and devolve? This is kind of a network model, a systems biology approach. This is not chronic disease management. This is really that functional, how is the body operating? And where can we identify those areas where we're losing resiliency? So Metabolic Code is a platform that assists in that process and allows us to scale, because then we can, deploy it across clinics. We can train practitioners in this approach. But the data is only so good. If you don't have access to great interventions, none of it is going to work. So it's one thing to kind of assess and say, okay, this is where you're at, Phil. Here are these areas that we need to target, but how do we best target them? If you're trying to improve performance and vitality and resiliency, it's not going to be the prescription pad, right? For me as an MD, I'm going to have to set a lot of that aside. So I have to ask a different set of questions. What else is out there that I can support you with? Of course, great nutrition is foundational. You got to get people on a good diet and moving and breathing and sleeping and recovering, all of the things that you already know how to do. But if I need to repair cell metabolism and rebuild the patient back up, I need to reach into the natural toolkit. And so that's where Metabolic Elite comes in, because we spent many, many years as a group of pharmacists and doctors of pharmacy and with expertise in natural product development, trying to figure out where are the best raw materials, but also how to deliver them in a very specific way. So Metabolic Elite represents probably the best in class for a variety of different natural compounds. One of the things that really distinguishes Metabolic Elite is the delivery system itself. So for example, take curcumin. Everybody knows curcumin is a great anti-inflammatory, but the challenge is how do we get it into the tissues and the cells? So a lot of companies try to figure that out. What we have access to is a very novel delivery approach, and there are two steps to the process. One is we nanotize down, we mill down the compounds so they're incredibly tiny, and then we wrap it in a special liposome that is presented as a chewable. So when you chew it, it goes directly through the buccal mucosa, the cheeks, and into the cells. We get incredibly high intracellular levels of whatever compound we put into this delivery technology. We call it LPT. So when you look on Metabolic Elite, if a label says, curcumin LPT or synapsin LPT, it's that chewable delivery system. We can put BPC 157 in the chewable. We can do synapsin in the chewable, which has that RG3 nicotinamide. The curcumin product is called TetraCure, so it's a turmeric curcumin combination. When you chew it, very high anti-inflammatory levels. We have a variety of natural compounds. What we don't want to be is all things to all people. We have maybe 15 or 20 products, but they're great products.
Sure.
And we're very careful because we try and ride the line behind what's great science and also what's effective. And so we're always using human dosing. We look at all the human studies and say, this is the dosing that you need to create change. So Metabolic Elite fills that particular gap for us. So we're very focused on performance. We're very focused on clinical outcomes, and we want best in class for that category.
I can honestly say I use synapsin LPT pretty regularly. Being able to, and a lot of times it's when you're coaching, when you're speaking, when I'm doing seminars, things like that, I will take it before that, and it's clear. I'm firing on all cylinders, per se. Being able to articulate my words properly, getting things out effectively. and be able to think and memorize, which is important. So I can attest to it, by the way. And also have done the TetraCure too as well.
Yeah.
Especially after training sessions, especially if my goal isn't to build or primarily work on hypertrophy. It's more about recovery so that I'm getting ready for a competition. So my recovery is the main aspect of the training, like being able to recover as fast as possible. So that's good. Make sure you guys check it out. Where can they go to find it?
JimLaval.com and Metabolic Elite.
Perfect. All right, guys, so there it is. 25 plus minutes. Don't hold me to it, whatever. We had a lot of information there. If you want to find my guy here, Dr. Andrew Heyman, where can they go to find out any details on what you have going on?
So in the very near future, in about 4 weeks or so, we're going to have a drmold.com website. And that's where you're going to see all of this information that we talked about.
What's the date on that? Do you know?
About a month from now.
So,
and it's going to have all the active research and what to do for my house, what to do for me,
Perfect.
All those products we talked about, what the ongoing research is, where I am in the world. It's all going to be there.
Be on the lookout for that, guys. I'll put some more in the show notes. Thank you guys for watching. Thank you, my good sir. We'll go ahead and train now. See you guys next time. Peace.